Diabetes can affect many parts of your body, including your skin. When diabetes affects the skin, it's often a sign that your blood sugar, glucose, levels are too high. This could mean that you have undiagnosed diabetes or pre-diabetes. Your treatment for diabetes needs to be adjusted. If you notice any of the following warning signs on your skin, it's time to talk with your doctor. Yellow, reddish, or brown patches on your skin. Necrobiosis lipoidica. This skin condition often begins as small raised solid bumps that look like pimples. As it progresses, these bumps turn into patches of swollen and hard skin. The patches can be yellow, reddish, or brown. You may also notice, the surrounding skin has a shiny porcelain-like appearance. You can see blood vessels. The skin is itchy and painful. The skin disease goes through cycles where it is active, inactive, and then active again. The medical name for this condition is necrobiosis lipidica. Get tested for diabetes if you have not been diagnosed. Work with your doctor to better control your diabetes. See a dermatologist about your skin. Necrobiosis lipidica is harmless, but it can lead to complications. Darker area of skin that feels like velvet. A dark patch, or band, of velvety skin on the back of your neck, armpit, groin, or elsewhere could mean that you have too much insulin in your blood. This is often a sign of prediabetes. The medical name for this skin condition is acanthosis nigricans. Hard, thickening skin. When this develops on the fingers, toes, or both, the medical name for this condition is digital sclerosis. On the hands, you'll notice tight, waxy skin on the backs of your hands. The fingers can become stiff and difficult to move. If diabetes has been poorly controlled for years, it can feel like you have pebbles in your fingertips. Hard, thick, and swollen-looking skin can spread, appearing on the forearms and upper arms. It can also develop on the upper back, shoulders, and neck. Sometimes, the thickening skin spreads to the face, shoulders, and chest. In rare cases, the skin over the knees, ankles, or elbows also thickens, making it difficult to straighten your leg, point your foot, or bend your arm. Wherever it appears, the thickened skin often has the texture of an orange peel. This skin problem usually develops in people who have complications due to diabetes or diabetes that is difficult to treat. Blisters. It's rare, but people with diabetes can see blisters suddenly appear on their skin. You may see a large blister, a group of blisters, or both. The blisters tend to form on the hands, feet, legs, or forearms and look like the blisters that appear after a serious burn. Unlike the blisters that develop after a burn, these blisters are not painful. The medical name for this condition is bullosis diabetricorum. Sometimes, it's called diabetic bully. Skin infections. People who have diabetes tend to get skin infections. If you have a skin infection, you'll notice one or more of the following. Hot, swollen skin that is painful. An itchy rash and sometimes tiny blisters, dry scaly skin, or a white discharge that looks like cottage cheese. A skin infection can occur on any area of your body, including between your toes, around one or more of your nails, and on your scalp. Open sores and wounds. Having high blood sugar, glucose, for a long time can lead to poor circulation and nerve damage. You may have developed these if you've had uncontrolled, or poorly controlled, diabetes for a long time. Poor circulation and nerve damage can make it hard for your body to heal wounds. This is especially true on the feet. These open wounds are called diabetic ulcers. If you have diabetes, you should check your feet every day for sores and open wounds. Get immediate medical care for an open sore or wound. Work with your doctor to better control your diabetes. This skin condition causes spots, and sometimes lines, that create a barely noticeable depression in the skin. It's common in people who have diabetes. The medical name is diabetic dermopathy. It usually forms on the shins. In rare cases, you'll see it on the arms, thighs, trunk, or other areas of the body. The spots are often brown and cause no symptoms. For these reasons, many people mistake them for age spots. Unlike age spots, these spots and lines usually start to fade after 18 to 24 months. Diabetic dermopathy can also stay on the skin indefinitely. Outbreak of small, reddish-yellow bumps. When these bumps appear, they often look like pimples. Unlike pimples, they soon develop a yellowish color. You'll usually find these bumps on the buttocks, thighs, crooks of the elbows, or backs of the knees. They can form anywhere though. These bumps appear suddenly and clear promptly when diabetes is well controlled. When these bumps appear, they often look like pimples. Unlike pimples, they soon develop a yellowish color. You'll usually find these bumps on the buttocks, thighs, crooks of the elbows, or backs of the knees. They can form anywhere though. No matter where they form, they are usually tender and itchy. The medical name for this skin condition is eruptive xanthomatosis. Red or skin-colored raised bumps. Whether this skin condition is associated with diabetes is controversial. We know that most people who have granuloma annulare do not have diabetes. Several studies, however, have found this skin condition in patients who have diabetes. One such study found that people with diabetes were most likely to have granuloma annulare over large areas of skin and that the bumps came and went. Another study concluded that people who have granuloma annulare that comes and goes should be tested for diabetes. Extremely dry, itchy skin. If you have diabetes, you're more likely to have dry skin. High blood sugar, glucose, can cause this. If you have a skin infection or poor circulation, these could also contribute to dry, itchy skin. Yellowish scaly patches on and around your eyelids. These develop when you have high fat levels in your blood. It can also be a sign that your diabetes is poorly controlled. The medical name for this condition is xanthelasma. Skin tags. Many people have skin tags, skin growths that hang from a stalk. While harmless, having numerous skin tags may be a sign that you have too much insulin in your blood or second-type diabetes. These growths are most common on the eyelids, neck, armpit, and groin. What is diabetes mellitus, commonly known as diabetes? Diabetes is a condition in which the body either does not produce enough insulin or is not able to use insulin effectively by the cells. Insulin is a natural hormone produced by your body's pancreas gland to control the level of glucose, a type of sugar, in your blood. As a result, if you have diabetes, the glucose in the blood, often called blood sugar, becomes very high. Although there is no cure for diabetes, it can be controlled with changes in lifestyle, diet and exercise, and treatment. It is important for people with diabetes to be diagnosed and treated as soon as possible, as high blood sugar levels can damage body organs and tissue, resulting in complications such as nerve damage, kidney damage, heart attacks, strokes, peripheral vascular disease, causing leg pain and ulcers in the feet, cataracts and loss of vision, among others. What is prediabetes? Although diabetes can appear without warning, most people go through a stage of prediabetes or impaired glucose tolerance prior to developing diabetes. If you have prediabetes, the good news is that you can reduce the likelihood of developing diabetes by changing what you eat and how physically active you are. Adding physical activity into your daily routine can help prevent or delay second-type diabetes if you are an adult at high risk of developing diabetes. Incorporating a lifestyle that emphasizes healthy eating with low carbohydrates, sugars, can help prevent second-type diabetes and manage prediabetes. Let's end the video here. On the channel you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and methods of treating them. Therefore, please do not forget to subscribe to the channel and click on the bell. I will also be grateful if you like and share the video with your family and friends. See you again.